Welcome to today's New England Himss webinar, Trends in Patient Risk Introduced by Connected Devices, presented today by Chad Holmes, who is Cynerio's security evangelist. All lines have been muted upon entry, so please send your questions via the Q&A feature, and Chad will answer them during the presentation. Chad helps educate the healthcare industry on threats introduced by devices in their environments. Prior to Cynerio, Chad worked with a variety of technologies ranging from call center software to military logistics systems. With nearly 20 years of helping create, break, and secure a variety of technologies, one thing has become clear: hackers are often far less sophisticated than many are led to believe. Please join me in welcoming Chad today.
Great, thank you. And thank you for the great introduction. Welcome, everyone. As we said, we'll be talking about trends in patient risk introduced by connected devices today. Before we start, a little bit more about me, just so you know kind of where we're coming from. Over the course of my career, I've shifted focus areas like many people often do. I started with a comp sci degree as a developer, making things. I was kind of writing code for military systems. Throughout that journey, I started to find a lot of really nasty security vulnerabilities, and it turns out many of them were very simple to exploit. So I shifted my focus from making things to actually breaking things. And I did that in a good way. I wasn't an evil hacker. I went in, I would help companies find those issues and then help them fix them. And as I worked with more and more security folks and more developers, I found that there's a lot of really smart people out there that may not be security aware, and with just a little bit of training can get this great security mindset and help them do their jobs better. And that's kind of along the lines of what I'm hoping to do today. So my goals today are one, to educate everyone, and it's two, to answer any questions. So please have questions come in as we go. We're going to start by talking about the state of cyber attacks in healthcare. We'll use some anecdotes as we go through, but what more importantly, I want to talk about the data and the trends we're seeing at a larger scale. So we'll take a snapshot of what happened in 2021 and then start looking at some of the data-driven advancements that we're seeing coming out of that data and other studies. I'm also going to share some guidance from industry leaders. I don't want to just get up here and say, hey, Cynerio says do X and Y and Z. I want to take the collective knowledge that we're seeing at conferences, other webinars, et cetera, and share that with you as well. And of course, I will try to provide references as we go through. I have a full reference page at the end of this that should cover everything I talk about today. If you have a specific question, let me know. I'll gladly answer it and give you references if I miss them. Bonus points to anyone that can identify that range in my picture on the left. I am also from New England, big hiker, particularly in northern New Hampshire. And if you can identify that range, I will give you a good pat on the back. So with that out of the way, a little bit about Cynerio. Cynerio was founded in 2017 with a pretty straightforward goal. We want to secure every IoT, OT, and medical device in healthcare environments. We spent the first couple of years of the company building out that core technology that allows us to do it. Went live with that technology in 2020, kind of right at the beginning of the pandemic, and were immediately recognized as a Gartner Cool vendor as well as a Forrester Wave, kind of two of the high awards you can get for a new company. On the back of those awards, we've started to expand our technology throughout not only North America, but worldwide as well, and are starting to see the results come back from our customers where, for example, we recently received a 96.1 class score based entirely on customer reviews. So thank you to any customers on the call that gave us those great reviews, and hopefully we have more future customers on the call that can get that number even closer and closer to 100. So with all of that out of the way, let's talk a little bit about the state of cyber attacks in healthcare. Again, I encourage everyone to ask questions as we go through. One of my biggest pet peeves when we talk about the state of cyber attacks in healthcare, particularly in written articles, is that these attacks get bundled in with critical infrastructure discussions. So you'll often see a title talking about, healthcare is being attacked, but it's very quickly shifts to things like discussions on the oil and gas pipeline, like the Colonial Pipeline, or it talks about water treatment plants. And I think this is really frustrating because when you talk to healthcare leaders, when you talk to people that are in charge of ensuring patient care, they don't really care about ransomware attacks on oil and gas pipelines. Yeah, they're kind of irritating in their day-to-day life, but in terms of saving lives and making people better, it doesn't really play that well. So what we have to do, first of all, before we talk about any trends, any data, is we have to recognize that there are actual anecdotal examples that we can use to show how bad a ransomware attack, a cyber attack, can be on a healthcare environment. And some of my favorites are folks like the University of Vermont, who were hit by a ransomware attack. Effectively, an employee went on vacation. They took their work laptop with them, as so many of us do. They looked at their email real quick, clicked on the link while they were poolside, and that started a network-wide ransomware attack. At the end of the day, they were down for about a month. They had well north of $60 million in recovery costs. The reason I call them out first here, though, is because they've done something far more important than just make headlines for that attack. Their leadership, their team has come out and said, this is what we experienced, this is what we should have done to avoid this, and this is what we recommend to others. So if you take nothing else from today's presentation, I highly encourage you to go to the AHA website, look for the University of Vermont podcast, and listen to that. It's going to be the best use of 30 minutes you have this week. Hopefully you stick around for the rest of this webinar, but make sure to bookmark that and do that. Beyond University of Vermont, though, we have folks like Scripps who have encountered over $110 million in costs from a ransomware attack. We have Skylakes Medical, which got relatively lucky at 10 million. And then we have folks in Ireland, their health service executive firm, which provides national care. It cost them about $600 million to recover, and they're still working through a lot of the issues there. So the first thing we need to do when we're talking about attacks on healthcare is actually talk about attacks on healthcare. Because if we go back and we talk about how to protect oil and gas, and we talk about long gas lines, it falls deaf to the leaders that we're trying to get funding from the leaders that we're trying to convince to invest more in healthcare cybersecurity. Next, we also want to make sure that as we go to those leaders and as we start to figure out what's going on in healthcare, we have an understanding of what's actually happening in those healthcare environments. And one of the best things we can do is start looking back at previous studies, start looking at data that's been available that helps us understand the real risk we're facing. So these are the numbers from 2021, obviously the last full year of healthcare information we have, and they're pulled from a couple sources that I'll name as we go throughout. But if you look at these, we're seeing continuing increases across the board for the third or fourth year in a row. In 2021, we had 700 plus providers impacted. That was a 10% rise year over year. And that accounts for about 10%, of the healthcare facilities in the United States. We saw 40 million patient records breached. Somewhere around 12 or 13% of the entire US had their patient records exposed in some way. That was up 30% year over year. And I think everyone on this call knows the fines and the audits that result whenever patient records are exposed. So massive, massive drain on the industry. And that's part of the major contribution to an estimated $21 billion a year in overall negative impact to the healthcare industry in the States. As we dive deeper and deeper into these attacks, though, we're starting to see different attack vectors coming out. So it's no longer just a rogue employee stole data or they lost a hard drive or a laptop. We're starting to see that attackers are becoming much more focused on how and where they attack systems. And one of the biggest surprises we saw in 2021 was a report was released, and again, I'll give this report in a second, where they identified that medical devices, IoT, IOMT, et cetera, anything from infusion pumps to security cameras and in between, 21% of attacks were rooted in those medical devices. Now, we're a medical device security company, and even we would have guessed 5 or 10%, but 21% puts it equivalent with phishing attacks. So we're starting to see that cyber attackers, cyber villains, cyber terrorists, whatever we want to call them, are finding new routes into healthcare environments to drive revenue. We'll talk about that more as we go. As we start to investigate these attacks, we also start to see that it's not just the financial aspect, it's not just patients' data being lost. We're also seeing that the collateral damage that comes from these attacks is having a direct impact on patient care, patient livelihood, sometimes mortality rates. Again, these were the initial numbers that were found in 2021. When a hospital got hit by ransomware, 71% of those hospitals reported a longer length of stays. Over a third saw increased procedural complications. And unfortunately, just over 20% saw increases in mortality rates. So while attackers typically don't try to impact patients, the result of their attacks, the result of encrypting systems taking them offline, has the natural collateral damage of actually impacting patient care and sometimes leading to increased death rates as well. And so this is where I always like to urge the crowd, if I were to ask you about different attacks that you've experienced, have you or have you not? And as we talk about studies today, we're going to find that the answers to all these questions are about the same. The number of people that have been hit by a cyber attack in the last 2 years, the number that have suffered at least one ransomware attack, the number that have seen adverse impacts, the number that paid the ransom are all about the same. It's kind of a coin flip situation where about half the time someone's been hit, about half the time they pay the ransom, et cetera. So while you may only see headlines here and there, while you may get the great, let's say, Becker's Health feed once or twice a day, and you might see the occasional ransomware reference, the reality is that ransomware attacks, cyber attacks are happening hundreds, if not thousands of times a year in North America, in the US, and they're having massive, massive impact on the operations of our hospital and the care of our patients. Now, of course, anytime you have bad news like this, we have to balance it out with the good news. So I always like to summarize the bad news as, the reality is healthcare is a primary target. And the reason that healthcare is a primary target is pretty straightforward. We're lagging in our defenses. If you look at someone in the investment banking industry, let's take Goldman Sachs, they're easy to pick on. It's easy for Goldman to build up their security defenses because everything for them comes down to profit and loss. If we spend X, we'll protect Y in revenue, and that is worthy of the investment. Healthcare is not like that. In healthcare, we want to put every single dollar we can into patient care and minimize all other costs. And unfortunately, that's led to an incredibly vulnerable footprint. It means that we have lower levels of defenses. It means we have very valuable data. EPHI is typically $250 to $500 a record, right? In comparison, credit cards are about $5 per record on the black market. So we have highly valuable data, lower levels of protection, and we have ransomware gangs that want to drive revenue because they are run like companies. And so what we're seeing is there is a very clear business-like approach to attacking hospitals because they're easy targets with valuable information. And so the financial impacts of that are clear, right? Either you have to pay a ransom or you have to recover your system. Those costs can be hundreds of thousands to tens and hundreds of millions of dollars. But what's not clear is that increasing care impact that we'll talk about more as this presentation goes on. And we're now getting to a point where attackers are becoming even more, let's call it greedy and aggressive when they find weaknesses in the system. So we're starting to see the next wave of attacks are evolving attack patterns. Healthcare used to be so easy to attack, and I mean in the last 18 months or so, that attackers would go in, they'd find the low-hanging fruit, exfiltrate data, steal it, move on. Now that we're seeing very baseline levels of defense being put up, we're seeing that attackers are evolving their patterns. They're not attacking immediately. They're going in, they're finding numerous vulnerabilities, and if you don't pay a ransom the first time, or if you don't protect your data the first time, or if you recover your system after the first attack, they'll go and attack the next vulnerability and the next one and the next one. And they can often sit in an environment for over 6 to 9 months before they finally pull a trigger, knowing it's going to drive revenue. So the actual bad news just keeps getting worse, but it's starting to lead to good news. The first thing is we have increased insight into what's happening because more people are doing studies. There's more independent researchers, there's more vendors, there's more healthcare leaders like University of Vermont that I spoke about earlier speaking out. And that increased insight is allowing us to move on from the anecdotal examples I shared earlier and focus more on the general trends. And as we start to see those general trends, we can start to figure out what is actually happening at a large level. We can start to take the data we're collecting there and use that to protect our environments. We're also seeing that the government is changing how they do things as well. I'm not here to have the discussion on where and to what depth the government should be involved, but we do know that the FBI is heavily involved in responses to ransomware attacks in particular. And several months ago, the FBI came out and said, we're going to take a different approach. They had previously been trying to go arrest and prosecute cyber attackers, cyber villains. Unfortunately, when many of these are rooted out of places like Russia, going and finding them, arresting them, prosecuting, not the easiest thing to do right now. So what we're starting to see with government agencies, including the FBI, is instead of actually trying to prosecute attackers, they're focusing more and more on hitting them where it hurts, in the wallet. So they're finding more and more innovative ways to track Bitcoin, for example, and recoup Bitcoin that has been used in ransomware payments, just as an example. So as attacker motives, as attacker vectors change, so does how the government is responding, and that is overall a net good. We're also seeing that vendors are being challenged to make more technical advances as well, Cynerio included. As we better understand the data behind these attacks, the motives behind these attacks, et cetera, we can actually start to build products that help defend against them, right? Things like automated inventory, things like better microsegmentation of your networks, et cetera. And I'll talk about those as we go on. So for all the doom and gloom that I've already presented up to this point, and some more that I'm going to present as we go through, do know that the data coming from these are starting to present more and more technical advances that are helping us all protect our environments, our healthcare environments, with lower effort, typically lower cost, and higher effectiveness. And so as we start to talk about some of the studies over the next few slides, I want to point out that most of the research our team does, whether it's our team's research, whether we partner with independent agencies, or whether we collate data from other research and data points, fall into three main buckets. The first is anecdotes. We talked about those a little bit, but we're finding that without a good story to tell, without good examples of what's happening in the real world, all these numbers, all this data can be lost really, really easily. So every time I can, I'll try to spice things up a little bit with a story or a tale or an example. If you need any, if you have a specific scenario that you're trying to solve or address and you need a story similar to that, let me know. I have a whole backlog that I can pull from. So we'll talk about anecdotes as we go through. We'll also talk about surveys. And with surveys, it's just what it sounds like. We'll create a bunch of questions, or independent third parties or our colleagues will send them out to healthcare leaders and get their answers. And what we're finding is this kind of voice of the customer, voice of leadership approach allows us to collate data, collect data in a way that isn't really readily available right now, at least in a public way. So for example, we all know that HHS has a wall of shame for data breaches. That's a good starting point for some research. There's some bad sides of that as well that we can talk about offline. But effectively, that only gives us one set of collected data that we can analyze. There are numerous other types of attacks, such as ransomware, where if data isn't stolen, isn't really reported in a public, collected, merged way. So by having surveys, we get to hear about people's individual experiences. They're often anonymous, so they're willing to share a little bit more, and it gives us a better idea of what you and your peers are experiencing every day. And then we finally have data analysis. Effectively, as we see more and more systems rolled out and more data is being processed in the cloud, to be clear, almost all, if not all of the systems that we work with and our partners work with leave ePHI on site. So we're not moving ePHI to the cloud. I want to be very clear about that. But as we start to see more data pools forming with anonymous data, with non-patient information, we can start to do deeper and deeper data analysis. For example, we can start to see what kind of devices exist in hospitals, where their vulnerabilities are, what their communication patterns are as well. So as we go through these studies, we'll talk about three different types of analysis, and I hope that's clear, but please do ask questions if we have it. The three primary studies I'll be talking about today, and there's a few others that I'll scatter in there, but the first is kind of the first real study we saw related to ransomware in the last 3 years or so. This was launched right in the middle of COVID. And it was done by Ponemon Institute, which is an independent research firm. You may know them from the annual IBM data breach report. They do a bunch of other reports, and they've recently started to focus more and more on healthcare, simply to help inform the healthcare industry about the attacks they're seeing. So Ponemon Institute partnered with Sensinet, which is a New England healthcare vendor, to release the impact of ransomware on healthcare during COVID-19 and beyond. Incredibly valuable report, gave us our very first real academic study into what was happening with ransomware. Highly recommend everyone read it. It's about a year and a half old at this point, but still incredibly valuable. On the heels of that report, our team did a data report where we went to our whole data pool of the millions of devices we've seen in our customers, analyze those devices, analyze the vulnerabilities, patches that are needed, about 50 different data points are in that report, and we released it in the State of Healthcare IoT Device Security in 2022. So that was less of a survey like the first one and more of a deep data dive. And then finally, we joined forces with Ponemon just recently. We released a report last month where we followed up on the natural questions that came out of the Cincinnati report and the Cynerio report to publish the insecurity of connected devices in healthcare 2022. So most of the data points that we talk about will come from these 3 reports. The very first thing, and I touched on this a little bit earlier, that we started to learn from that first report, that Cincinnati and Ponemon report, was that the attack vectors being used to hit hospitals were far, far different than anyone would have anticipated. I think a lot of us would have expected cloud applications, some level of phishing, but what really did jump out, was the rate of attacks that involved IoT and medical devices, right? This is equivalent to phishing almost as much as cloud applications. And the sad truth of it is that we've adopted incredibly rapidly over the last 8 to 10 years, these highly functional, highly helpful devices that provide great care. On average, it's about 15 devices, connected devices per bed in a hospital. It means if you have a 200-bed hospital, you've got 3,000 IoT devices of some sort in there. And so we've adopted these great life-saving caregiving devices, but we've put very, very little thought into how to secure them. The manufacturers haven't thought about how to secure them all that well. They've cobbled together a bunch of different technologies. They haven't been deployed securely. Patch management can be incredibly difficult, so they're often not up to date on patches. They're often deployed to networks that are very flat, meaning any one device can connect to others pretty routinely, meaning vulnerabilities, attacks can spread throughout an environment. So amongst the other things that this study found was that this is a massive weak point where there are not traditional protections in place, where there is vast room for improvement. So as you're going through and you're looking at your environment, your Windows machines are probably very secure. Your traditional IT systems are probably up to date with the latest patches, with the latest protections, firewalls, et cetera. But things like IoT devices and to some degree exposed APIs give you the greatest area where you can greatly improve security with relatively little spend compared to some of those other IT systems. On the back of that report, as I mentioned, we dove deeper into the data that we had available, that large data pool, again, of non-patient data that's available. And as we started looking at these devices, we realized the level of insecurity was even worse than we thought. We knew it was bad, we didn't know it was this bad. We looked at the devices, found over half of them, IOMT and IoT devices, contain critical risk. If this number is familiar, we were very excited yesterday to see that this was released in the latest FBI private industry report. So FBI periodically goes and releases stats and guidance related to certain fields. They did this for healthcare yesterday, used 1 or 2 of our stats as well as some of our guidance. And as you might imagine, that was incredibly, made our team incredibly happy. But about half of devices that we find, and half of devices across all environments, have critical risks of some sort. It doesn't mean that it's easy to attack those critical risks, but it does mean that they do exist and they should be addressed in some way. We also found, as we studied these devices and watched their communication patterns, that about 80% of the devices are used every 4 weeks. And while that's interesting for HTM teams, for example, for the biomeds and clinical engineers out there, that it can be really difficult for security because it means that the frequent use of these devices, 1, is optimizing spend, but 2, makes it really, really hard to pull them offline and maintain them, particularly if they're providing patient care. So now we have really vulnerable devices. They're seeing frequent use, so they're hard to maintain. And then we have really common ones like IV and infusion pumps, where nearly 40% of the devices we find in hospitals are IV pumps. Perfectly logical. It's one of the first things that interacts with a patient when they come through the door. They're everywhere. You know, they're in rooms, they're literally in ceilings, they're hidden in closets so people can have access to them. So about 40% of devices we see, and unfortunately 73% of those have at least 1 critical risk. So they're ubiquitous devices that are incredibly vulnerable. Doesn't necessarily mean that they'll be attacked, but they're often used as jumping off points for other attacks. And then finally, we start to see that there is some basic way that we can start to protect against these. You know, patching every single device and making sure every single 0-day is patched is an incredibly difficult and I'd argue impossible task. But if we can start to look at the network and the environments they sit in, we find that hardening networks can be incredibly valuable, particularly with something called segmentation or microsegmentation, where we cut down on the communication patterns between devices. So instead of an IV pump, for example, communicating with every single other IV pump, maybe that only communicates with one or two other systems, like a nurse's station. And so if we cut down those communication patterns, we can actually start to see higher levels of protection, lower level of spreads of malware and cyber attacks, et cetera. And so on the back of the Cincinnati and Ponemon report and back of our data study, we teamed up with Ponemon Institute to follow up on the obvious questions we were seeing around impacts to patient care, around costs, around ownership, et cetera. And as we go through this, I want you to remember, there are clear ways that we can address these, but we have to understand what the real scenario in healthcare environments is. And so the first thing that we looked for when we got the results back was, what were the actual threats to patient care, right? Is this something that patients would be minorly irritated? Was the Cincinnati original report accurate in terms of mortality rates, et cetera? And the reality, not to anyone's surprise, unfortunately, is that the cyber attacks are frequent. They have significant impacts on patients. Half of the time, about 56% of the time, there were one or more cyber attacks in the last 24 months involving a device. That means the number of cyber attacks was even higher. That's just the baseline that includes those medical devices I've been talking about. And the frequencies of these attacks is what really, really stood out. What was assumed up until about 6 to 9 months ago was attackers would go in, they'd exploit something, they'd move on to the next hospital. And as we started studying the frequency of attacks, we realized that wasn't the case at all. Attackers are going in, as I said earlier, and they're sitting in there and they're looking for multiple different vectors. 82% of the time, when a healthcare environment was intact, they were attacked 4 or more times. 11% of the time, 1 out of 10 environments that gets hit saw attacks 25 or more times. So we're no longer seeing attackers go in, hit it once, and move on. They're going in, they're sitting there, and they're planning attacks until they can drive revenue. That's incredibly scary, because it means if you don't have an attack that you found yet, they're probably just doing their investigation, sitting there waiting to pull the trigger. And then as we looked at the results of those attacks, we found that about half the time, you'll hear me say that a lot, there were adverse impacts. 45% of the time there was an attack, there's an adverse impact. And the most kind of damning statistic that came out was 53% of the time we saw increased mortality rates. If you do the numbers on that real quick, about 1 in 4 attacks, 24% of cyber attacks in healthcare environments lead to increased mortality rates. Again, not meaning to be doom and gloom here, but the reality of the situation is that the collateral damage from these attacks, which are driven by revenue, does have an impact on patient care, and in some cases, lives. The next thing we started to look at even deeper was the attack frequency and those outcomes. And again, about half the time we saw that you're in a room with someone that's been attacked, if there's 2 of you there. 56% of respondents experienced at least 1 attack the last 2 years. We talked about this. We have 243% stats. 43% of hospitals have experienced at least 1 ransomware attack. Doing some quick math there, that puts at around 3,500 or so hospitals in the US have experienced at least 1 ransomware attack. It's a terrifying number. And 43% also experienced loss of patient data in the last 24 months. So what we're seeing is that attackers continue to go after hospitals in different ways. If you're not going to pay the ransom, they're going to steal your data. If they steal your data, they're going to sell it on the black market. You're going to see fines, audits, et cetera. So it's an incredibly dangerous environment to work in. And again, if you've seen 1 attack, you've likely seen many more. When we looked into data breaches specifically, we saw that 65% of the time, if you've been hit by a data breach, you were hit by 5 or more. In almost 9 out of 10 of those data breaches, it involved IoT or IOMT devices. And I don't mean to laugh there or be flippant about it, but these devices are a massive entryway. They're a massive replication point. They are technical marvels that are introducing significant risks into environments. And it's something that we need to address very, very quickly. And then as we started to look more and more into ransomware, some numbers started to become more and more clear. We saw, again, that ransomware attacks, 76% of the time, people that experienced ransomware saw 3 or more attacks. 15% of the time, it was 10 or more attacks. So again, they're getting hit over and over and over. And this number on the right started to clarify things even more. We started to see that ransoms were consolidating into a couple of clear ranges. And the most common ransom paid was about 250 to 500K. And we were curious about why this number was so specific, right? It used to be kind of 100K to 1.5 million was the accepted range. And as we talked to more leaders, as we got more insight about what people were experiencing on the ground, it became very clear. Cyber attackers have found a range of data where they can draw from effectively slush funds in hospitals. They can go to leadership and say, for this amount of ransom, we will restore your systems. Also for this amount of ransom, this 250K to 500K range, you probably don't have to go to the board for approval. You may have that in discretionary funds, and we can be done with this whole incident today. However you want to report this after the fact, you can handle. And so what we're seeing is that attackers are creating an incredibly efficient market. Again, it's evil. I'm not proud of them. I wish it wasn't the case. But they have found a market where they can go after a certain amount of revenue, a non-negligible amount, and they can get paid off incredibly quickly. And healthcare leaders are put in an awful situation where either they encourage future ransomware attacks by paying the ransom, or they're facing tens of millions of dollars in recovery costs that could put them out of operation for about a month on average. And so we're seeing this really efficient market of cyber attacks and ransoms being paid that has developed. And the going rate is somewhere in the 250 to 500K range. Again, any questions on that, I'll be happy to break it down a little further. We do have some additional insight. And so as we investigated that more and more, we started to ask, who owns this? Who's responsible for this? Who should be taking care of this? Most healthcare environments are very, very well structured. They have clear chains of command. They have numerous different ways to actually address numerous different problems that none of us can even think of. Who owns cybersecurity? And the reality is that there are no consistent owners. We asked who's responsible for securing IoT devices in your environment. Those devices we talked about that are really insecure but provide really good care. And we expected that one or two clear answers would come through. And the reality is the answers were just a complete grab bag. We saw everyone from the CEO mention that top there at 2% to folks like users of medical devices, including nurses and doctors at 9%. I don't want CEOs being responsible for these. I don't want nurses being responsible for these. I want the CEOs to run the hospital efficiently. I want a nurse to provide great care like they always do. So it became clear once we started seeing these stats that a lot of the reasons behind the security issues we're seeing, it's not laziness, it's not lack of care, it's not knowing how to do it, is that no one actually owns the problem. Everyone assumes someone else owns it, and therefore it goes unaddressed. And as we dove deeper and deeper into ownership, we asked, well, who do you think should own this? Should it be the hospital? Should it be the manufacturer? And the right answer would be that middle number there. We were hoping we'd get 100% saying everyone should work together to secure these. And the actual answer was really disappointing. Everyone pointed the finger at someone else. A third said that a healthcare organization or a hospital should own security. A third said that a third party should own it. A third said the manufacturer should. And so we all know defense in depth is always the best practice. It's what we want to address whenever we can. But the reality is, if no one owns it in the healthcare environment, no one's going to take responsibility, and they're always going to kick the can down the road there. I just got a good question coming. Will the presentation be sent to participants? The presentation should be downloadable. If it's not, we can certainly send it out after the fact. Cool, good question. Keep those questions coming. So at the end of the day, one of the core challenges that healthcare has is that no one is responsible for making sure the devices are secured. And when no one's responsible, it's just not going to get done. We're going to continue to see these attacks happening. And so that led us to zoom in on the reality a little bit more. And the reality is, I wish I wasn't understating this, is we negotiate with cyber terrorists, right? We know that about half the time, 40% of the time, 7% of the time, a ransomware attack happens, the ransom is paid. We just know that if a leader can get out of a ransomware attack for a couple $100,000 and be operational that afternoon, they're going to do that about half the time. And again, we know that they have a very clear amount they're going to see. Now, we often have the question of, doesn't cybersecurity insurance cover this? And even there, we're seeing cybersecurity insurance providers pivot how they're addressing this. They're focusing less and less on system recovery, and they're focusing more and more on negotiation. They're focusing on ways to quickly respond to ransomware attacks, respond to the requests, and then negotiate the price down as much as possible. They're also becoming increasingly audit heavy. As they go through that negotiation, they will only cover you if you meet very strict audit terms, and that's leading to a lot of people self-insuring instead. So unfortunately, because we're driven by providing care, which is the right thing, we're starting to see more and more people focus on paying the ransom for quick recovery rather than doing the hard, long-term expensive work of restoring a whole system where uptime may not be guaranteed once it is deployed. And the answer as to why they're paying it pretty clear. I mentioned earlier, a combination of downtime and money. When asked why they paid the ransom, nearly 70%, that second line, said flat out, we cannot afford downtime. We cannot have our systems go offline, particularly if you're a rural hospital, which most hospitals are, rural or small of some combination. They are the only ones within dozens, hundreds of miles in some cases. They have to provide care. They can't have downtime. And they see an easy path to restoration because a surprising amount of the time, the systems are fully restored very, very quickly. And so the avoidance of downtime and then the avoidance of data leaks, because we've all been trained to avoid data leaks. One, because it's the right thing to do, but more importantly, because you will see fines, you will get press, you will be on the HHS wall of shame. That has very real financial impacts. So at the end of the day, actions in responses to ransomware are driven by money and downtime. Proactive actions could prevent a lot of this, but this is where we are as an industry. And if we really want to paint the picture of what could go bad, I want to present some research that our team did. Athon Tug robots are these really helpful, really cool robots that exist in healthcare networks and hospitality areas. Hotels have them sometimes. And they go about 2 miles an hour. They zoom around the hospital at a rather slow pace. And they carry everything from linens to food to use medical equipment, et cetera. So for the most part, they're kind of boring, but really helpful systems that replace folks that are typically running kind of in the 6 to 10 miles per day just to do all this stuff in the hospital. As we were researching a customer environment, we started to see weird communication patterns between these robots and elevators. And we started to find that these robots, both in terms of their core technology, as well as the way that certain hospitals were deploying them, opened up the hospital to multiple attack vectors. The robots could be controlled by a dashboard that was available. They could interact with patients in incredibly basic ways. They could potentially be coordinated to move throughout a hospital. So when it comes to cyber physical systems, it's not just about exposing patient data. There are very real direct outcomes we could see, whether it's a hospital robot being taken over or a full fleet of robots being taken over, or the collateral damage of care not being available and caring systems not being available to patients as an attack has happened. And again, we have a whole lot more info on our website about that, a bunch of webinars and rapid recaps if you want to learn more details about that as well. All right, so where does healthcare cybersecurity go from here? I don't want to be all doom and gloom today, so let me see if I can give you 10 or 15 minutes of guidance. A lot of the guidance I'm going to provide is based on a webinar that our team did about 2 or 3 weeks ago. Effectively, we got different leaders throughout the healthcare industry, Matt from FHA, who they go in, they're an MSSP, Managed Security Service Provider, and they go in and they help hospitals start up their security program very, very quickly and very, very effectively. We had Hector Rodriguez from AWS, who is helping educate hospitals on cyber resilience. And then Jim Wilton from Nuvolo, who's the Chief Product Officer in building out things like CMMSs. So we started to ask them, what are your teams doing? When you go in, when you roll out a new product, when you roll out a new service, what are you seeing? How do you advise your customers? And the first thing I asked them is, what can we do? And all three of them immediately said, knock down the silos, right? Healthcare is an industry that's unique in a bunch of ways, but one really unique aspect is that healthcare environments rarely compete with each other, right? Meaning hospitals that might be 10 miles apart rarely compete for the same amount of revenue. They're just trying to serve the community. So we have to stop being kind of tribal in our communication. We have to start talking more about this. And it's why I like using that University of Vermont AHA example from earlier, where they came out and said, this is what we experienced. We need to start having more of those discussions. It's hard to do. It can be risky for people, but it's something that will help the industry as a whole. So whether it's in conferences and back rooms, whether you're getting up on stage, whether you're speaking to press, the more we can educate each other and the more we can share experiences, the faster we'll be able to address the attacks that are happening. The next thing they said is everyone needs to find the leader that's going to enable modernization. And I think we've all seen the leaders that enable new gadgets, new IoT devices, new ways to give care. We see that in healthcare a lot. But we need kind of the boring behind the scenes leaders as well that are thinking about how to secure these devices. Within Cynerio, we call this finding your Charles. Charles was one of our first customers. He was an HTM manager who looked around and realized how at risk the environment was because of these devices and said, no one else is taking ownership of this. I'm going to figure out a way to do it. So that can be a very difficult role. You're going to hear no a lot. You have to fight for a lot of budget. You have to introduce new concepts and technologies. But it's a role where your patients will thank you. The healthcare environment will be far less likely to get attacked. And, frankly, your career will thank you as more and more people adopt these practices. So they said, so the leaders we talked to said, get a little risky with your career, encourage people to do the right thing in security environments. Next, one point that Hector from AWS made was that we have to stop thinking in terms of cybersecurity and start thinking in terms more of cyber resilience, right? Think about the bigger picture. Because when we're talking about what drives hospitals, it is that downtime that we talked about earlier. It is that financial motivation. So we have to think about what happens not only when there's a cyber attack, but what happens if the power goes out? How are the systems restored there? What happens if there's an earthquake? One of our customers is in Marin County, north of the Bay Area. They have to build new facilities because of seismic stability. So as you're thinking about cybersecurity, don't think about it in terms of bits and bytes necessarily, right? We can handle all that. We'll figure out how to do it. But think about it in terms of your overall resilience strategy and how you keep devices, patients, et cetera, online in the worst case scenario, whether it's a ransomware attack, a blizzard, or anything in between. Next, and all three agreed on this, was to enable teams, right? Hold lunch and learns, have two-way communication, allow IT to talk more effectively to HTM and biomeds and vice versa. One of the things we found as we go through is that security is incredibly intimidating, right? And believe it or not, security folks can be kind of hard to work with sometimes. At least that's my experience. So if we can do some of the basic education, if we can give people the ABCs and increase communication, increase education, we're going to start to see more pervasive security thinking throughout the environment. It doesn't mean everyone has to become a security expert, but just like we're seeing with phishing training, where if you click the link in the test phishing training, you get slapped on the hand. The more basic education we can do, the more basic encouragement we can give, the better the entire environment's going to be. So it's not just that you have one or two security guys or girls, it's that you have a whole team thinking about security at some point in their day-to-day. Next, and we have a lot of customers that do this, our peers, our partners do as well, exploit vendors for knowledge, right? Vendors love to come in, they love to give lunch and learns, they love to feed your team. There's going to be a little bit of a pitch in there about their products, but you can find that if you do a lunch and learn, there's a lot of this training that exists that if you give it to your team, one, it's going to be a great way to build team, and two, it's going to help educate them. Even if you're not in one physical location, doing sessions over Zoom. I know we all have Zoom fatigue, but doing a monthly education session over Zoom is going to help increase the knowledge of your team and give you a way to bond that you may not otherwise. And then finally, everyone encouraged to embrace expertise. The sad reality, particularly for smaller and rural hospitals, but this hits the bigger ones as well, is that it's incredibly difficult to find cybersecurity expertise. And the likelihood of you building out a self-sufficient, full cybersecurity team is very, very close to zero. We've seen a few people do it, but more often than not, you're going to use some combination of vendors, outside technology, et cetera. So start embracing folks like the MSSPs I've been mentioning, who come in, they have the experience, they're often remote, but can be on site as needed, to quickly ramp up your security practices, often at a lower cost than it would take to work on your own. And again, if you need help finding MSSPs to do that, let me know and I'll happily pass you off to some of our partners. The other thing that they started recommending was a roadmap on how to actually address these. And I encourage everyone to take a picture of this and ask me questions you have. But these were tasks that, you know, the expert panel said you should start doing over the relative timelines. There's a lot you can do today, right? So it is what, 12:45 Eastern time. There's a few things you can do this afternoon just in terms of asking questions. Start understanding your current environment. What assessments have you gone under? What audits are responsible? Who owns those processes? And you may find that no one owns them, or they might be years out of date. And asking the simple questions of, well, what are we going to do next, can start to drive a little bit of action. Next, and this is one of my favorites because it's really interesting to be a part of, is doing tabletop exercises for incident response, role-playing type things. What happens when your system goes down? Who do you call? Like, if your phone is locked out, if your computer is locked out, who are you actually going to call, and do you have their number? We've seen executives that just have a piece of paper with emergency contacts written on it in case they get attacked. And that's incredibly valuable. It's one of those things you don't know to do until you've experienced it. So working with people who know how to run those tabletop exercises, who know how to do the role playing that you'll need in the critical moments, is incredibly valuable. It may only take an hour or two, but it's a great, great exercise. And then again, continue to ask the simple questions. Where is the asset data? Do you know? Do your teammates know who owns it? If it's just one person that goes off on vacation for a week or two, what happens when that person is away? So today, start asking those simple questions. This month, start embracing industry groups. I'm sure we all know some combination of HISEC, the Cyber Health Working Group, Chime, AHIS. A lot of these groups not only have big events and webinars, et cetera, but Himss, of course, I need to mention Himss on a Himss webinar. Himss, of course, is a great one. A lot of these have webinars and educational sessions, but they also have semi-private or semi-closed email lists where healthcare professionals can share and ask questions. And they do a really good job of keeping vendors silent there and making sure that it becomes more of a productive grounds for discussion rather than, you know, kind of promotional food. So start getting involved with these groups in one way or another. Start speaking with experts, asking questions, reach out to vendors, reach out to others that have been there. There's a lot of healthcare leaders that are coming out and realizing they can make a very good name for themselves by sharing their experience. So reach out to them. They're incredibly responsive. And then read the research. I'll provide you a bunch of references you can read at the end of this, but take time to read the research, see the summaries, dig deeper if you have the time to, or just keep attending webinars like this because they're incredibly valuable in presenting that research in a condensed way. As you move on from joining those groups, start thinking about what you can do this quarter. Get an updated cybersecurity roadmap together. If you're like most places, that roadmap is probably a few years old at this point for obvious reasons. So start thinking about what the updated cybersecurity roadmap looks like and think beyond IT systems. Don't just think about all those Windows machines. Think about those thousands of other devices you have, whether they be the Tesla connecting to your environment, all those IoT devices, or just those unmanaged devices you don't know about. How are you going to begin addressing those? Next, begin the funding discussions. This is another pet peeve of mine. Every survey you see with healthcare leaders right now, within the top 3 answers, the leaders say, cybersecurity is a top priority for us. Start asking them what actions they're going to be taking. That's not an easy discussion. Might be one better done behind closed doors, but make your leadership walk the talk. If they're going to say they are concerned about cybersecurity, start seeing how you can get involved in implementing cybersecurity practices. Because in all likelihood, they need help with researching, they need help with different approaches, they just need help with interacting with vendors and understanding where protection should be in place and where you can kick the can down the road a little bit more. So start talking to your leadership and see where you can help them. That's going to be incredibly valuable. And then in the next quarter, try to kick off at least one project of some sort. It might be something as simple as making sure your inventory is accurate. Because if you don't know the devices you have, if you don't know how they're interacting with patients, if you don't know how they're connected with the network, you don't really know how to secure them. So kick off an inventory project. If you have that, kick off a microsegmentation project. Microsegmentation is effectively, like I mentioned earlier, making sure all the devices aren't just sitting on this very flat network or grouped into 1 or 2 small VLANs. Make sure they can only communicate with the other devices they need to. That's going to help cut down on attacks significantly. And then finally, you could do something like a CMMS audit. We did this with a customer recently, and we're shocked with the results. As we were going through the inventory steps with this, we started to see that there were hundreds of devices. I think there was something like 800 or 900 touchscreen monitors that they didn't even know about, and they had to investigate further. We found that there were about 300 devices where they had the wrong serial number put in, because when they acquired those devices, there were 2 serial numbers and they chose A over B, and it threw off the complete audit until we were able to reconcile those. So doing something as basic as a CMS audit will not only help you learn how to better secure the devices, but they'll help you understand what devices you have, understand what the utilization may be, understand where you have to order more, or even better, not order more because you found others that were hidden in closets or ceilings, or whatever the case may be. And then over the next year, start to engage with an MSSP. I would recommend you do this month, but realistically in the next year, right? Bring in the experts that can help you roll out new tools, new technologies, new approaches. We've partnered with a bunch of folks like HSS, like Synergistic, FHA. There's a bunch of really, really good ones out there. They're typically somewhat regional. So let us know where you are, who you're working with. We'll gladly put in a good word for some MSSPs. And start to adopt modern technology with those MSSPs. Typically, they will bring in recommended technology when they come in-house. You know, find ways to do passive analysis where you can identify and secure devices without actually interacting with them in a way that may be dangerous to patients. Integrate that with your CMMS, continue your segmentation of your network, and then automate as much as possible. And then finally, as you go further and further down this journey, heavily encourage you to share your experiences. Speak at conferences, speak at local Himss groups. I know New England has, Himss has one coming up in Lebanon in a couple of weeks. Share your experiences. You'll be shocked the number of groups that are dying for any good cybersecurity discussions. And what you may take for granted is something that can help dozens of other people. So please speak up and share what you've been through. And then finally, I want to encourage you to err towards action. In these surveys, when we ask people, you know, how mature is your organization? Less than a quarter said they were at a mature stage of cybersecurity. That's not a real surprise. What was frustrating to us, though, was the answer on the right, which is what would make you increase your budget to reach a stage of maturity. And it's kind of what you'd expect. If we get hacked, we'll think about it. Otherwise, we're good where we are. And that's an incredibly dangerous and frustrating mindset because there are known ways to prevent attacks. There are known ways to get ahead of things, but there's a lot on people's plates and they err towards actions in other areas. So I'd encourage everyone on this call to err towards action in some way. Some ways you can take action today. And this is typically how Cynerio approaches this. You know, feel free to ask questions about your specific situation. I'll gladly modify these. But what we see when we roll out our technology, as well as when our MSSP partners roll this out, is there's typically an initial phase. This can take anywhere from a few days to a few weeks, maybe a month or two. But what this does is it gives you full device visibility and inventory. One of the really great things about IoT devices is that they're very chatty. They're communicating on the wire all the time. So they give you a lot of information. They allow you to automate the discovery of them, see what they are, see where they are. We can actually physically map them in a hospital so you can go and track them down very easily. Also, put in a system that allows you to detect attacks in your environment. A lot of the time, healthcare environments operate in a very different way with very different communication patterns. So attack detection technology isn't really good at picking those up. Things like our ADR product allow you to detect those attacks and respond to them very, very quickly. Remember how I said attackers typically sit in an environment for about 6 to 9 months? We're able to identify their communication patterns and make sure we defend against them before they pull that final trigger on an exploit. And then finally, what we start to do in phase 1 is improve HTM efficiency, right? As we start to see where the devices are, how frequently they're being used, we start to see that biomeds and CE folks are able to more quickly get to a device, maintain it, patch it, get information, and put it back online. So while the security stuff may be a pie in the sky kind of goal that we're shooting for, actually making your HTM team significantly more efficient within a few weeks is a great side effect that we've seen out of our security technology, and we continue to build tools for them out of that. Next, we start to see people focus more on risk reduction. So as we find risks, we identify and prioritize that risk. So we're not saying here's 10,000, good luck. We're saying here's 10,000 risks, but these are the 7 you should really worry about this week, and then we'll work down the list. So prioritization of risk is really important. Mitigating and remediating those risks in an effective way is equally important, right? We want to make sure that either the risks are fixed through remediation or that protections are put in place. They're mitigated if you can't fully protect against them. And then finally, starting to understand device utilization on that HTM scale so we can see when to take things on and offline for maintenance can be very powerful. And then finally, environment hardening. Make sure that you harden your environment, close down all those entryways, put as many protections in place as possible. So we're near the end of the presentation. See a couple questions that are coming through. Please throw a few more in there, but here is a full list of resources available to everyone. This should be in the deck that is available to download. If I mention anything that isn't covered here, let me know and I'll be glad to get you the link. If you do have other questions, go to our website at cynerio.com. You can reach out directly to me at chad.holmes@cynerio.com and find us on every major social platform. With that, I thank you all and we'll take any questions you have today.
Thank you, Chad. I don't have any questions yet in the Q&A, but it is open. So I know we are nearing the hour. So if you'd like to throw those in there, we do have a few more minutes. If you think of something after the fact, when you exit today, there will be a survey, so you can throw a question in there for Chad as well, and I'll make sure he gets that and gets that answer to you. I want to thank Chad and Cynerio for presenting for us today, and everyone who joined us. And he did a fantastic mention there. We do have our first in-person meeting coming up on Wednesday, September 28th in Lebanon, New Hampshire, and at the Hilton Garden Inn. And it is focused on how to deal with healthcare IT challenges and what to do to overcome them. So our registration can be found on our website. And lastly, give us your feedback as you leave today's session. We're grateful for Chad's time, and your feedback would be fantastic. So without further ado, Chad, I'm going to close out the session, and thank you again. And everybody have a great week. Thanks so much.
Oh, we got one Q&A coming in. Oh, okay, never mind. Nope, we got it. Never mind. Thank you, everyone. Have a great day.
Excellent. All right, thank you.